Hello, my name is Haley Chiswick. Here at the University at Buffalo, we are proud to have developed the Buffalo Concussion Bike Test, or BCBT. This video is designed to help teach you how to administer and interpret the BCBT. Additional resources on the BCBT and other concussion assessment tools can be found on our website, concussion.ubmd.com. Before we start, here is a word from our research team.
Hello everyone, my name is Nader, and I'm the Director of Research for the UBMD Concussion Management Clinic and Research Center. And today, we're going to be talking about the Buffalo Concussion Bike Test, or the BCBT. The BCBT is a cycloergometer version of the Buffalo Concussion Treadmill Test, and it is used to assess the degree of exercise intolerance in patients with concussion. Before you begin the BCBT, it is important to consider the equipment you have available. Although we recommend that you use a cycloergometer that has adjustable wattages, we understand that not everyone has access to these kinds of bikes. In these situations, experienced clinicians should use the bike that they have available and increase the intensity every minute based on their patient's athletic fitness. An important thing to know is that there are two protocols for the BCBT, the research one and the clinical one. The research one, which is published in peer-reviewed medical journals, uses 2-minute intervals for each stage. This is only required when you're doing exact physiological measurements. The clinical protocol, which we will be showing today, uses 1-minute intervals for each stage, and that is similar to the Buffalo Concussion Treadmill Test. Keep in mind, the BCBT is a clinical test, and clinicians have the discretion to adjust the protocol to meet their circumstances.
This test is designed to assess the degree of exercise tolerance in patients with concussion, establish a safe level of exercise for the treatment of concussion, help differentiate between concussion and other possible diagnoses for concussive symptoms. The BCBT alone should never be used to make a diagnosis of concussion or determine clearance to begin the return to play protocol. This is a supplementary test and should be interpreted alongside a complete history and physical examination completed by an experienced provider. Unlike the treadmill exercise tests, the BCBT is completed while in a seated position. Therefore, this test is reasonable for patients with significant vestibular or balance problems that prevent them from walking safely on a treadmill. Before beginning the BCBT, patients should be evaluated for any contraindications to exercise testing. This list can be found in the BCBT manual on our website. Absolute contraindications: acute myocardial infarction within 2 days, high-risk unstable angina, uncontrolled cardiac arrhythmias causing symptoms or hemodynamic compromise, symptomatic or severe aortic stenosis, uncontrolled symptomatic heart failure, acute pulmonary embolus or infarction, acute myocarditis or pericarditis, acute aortic dissection. Relative contraindications: left main coronary stenosis, moderate stenotic valvular heart disease, electrolyte imbalance, severe atrial hypertension, tachyarrhythmia or bradyarrhythmia, hypertrophic cardiomyopathy and other forms of outflow tract obstruction, mental or physical impairment leading to an inability to exercise adequately, high-degree atrioventricular block. The BCBT is not recommended within 24 hours of concussion or if the patient is too symptomatic at rest and cannot tolerate low levels of physical activity without significant symptom exacerbation. There are a few safety considerations you should be aware of before starting the test. We suggest that the examiner who conducts the BCBT is trained in CPR and that an AED is always available. We also suggest that examiners converse casually with the patient during the test. If the patient seems to have difficulty communicating, looks suddenly pale or withdrawn, or appears to be masking severe discomfort, the examiner should stop the test and take the appropriate action to ensure the patient's safety and wellness. The examiner should also be aware of postural and structural changes such as slouching or head leaning. Noting the patient's thoracic and cervical posture may offer clues on the etiology of the injury. Here are the supplies you will need to perform the Buffalo Concussion Bike Test. A recumbent or upright stationary bike capable of maintaining a constant power output or workload measured in watts that can be controlled by the test administrator. A heart rate monitor, we recommend a Polar OH armband or chest band. The BCBT assessment form found on our website. The BCBT weight to power/watt conversion table found on our website. A visual analog scale or VAS, a Borg rating of perceived exertion or RPE, an AED, a chair, water, and towel for patient recovery after exercise. To get started, ask the patient to arrive ready to exercise. Patients should be dressed for exercise in comfortable clothes and shoes and wear any vision or hearing aids they usually need. Patients should also be hydrated before completing the test. Begin by explaining the test procedure to the patient. Allow the patient to ask any questions. Inform them that participation is voluntary and that they may stop the test at any time. Have the patient wear a heart rate monitor per the manufacturer's instructions. Record the patient's heart rate and baseline symptoms after 2 minutes of seated rest. Concussion symptoms should be recorded on the 0 to 10 VAS scale. It is important to explain and demonstrate the VAS and RPE scales before the test begins. You should remind the patient that they will be asked to rate RPE and symptom severity every minute during exercise. The RPE and VAS scales should be placed within a comfortable viewing distance of the patient while on the cycle ergometer. We recommend placing the scales somewhere that the patients do not have to turn their heads to view. This is important because RPE and VAS scores will be collected every minute during the test. During the 2-minute seated rest or before the patient arrives, the examiner must determine the power output or watts required for each stage according to the patient's weight. The power output conversion scale is available in our manual and on our website. Now we are ready to begin the test. Before the patient sits on the cycle ergometer, adjust the settings, seat, and handlebar heights as needed. The bike should be set to the correct power output based on the examiner's prior calculation. Record stage 0 values right as the patient begins to pedal. Stage 0 occurs when the patient sits on the cycle ergometer immediately after starting the BCBT. The patient should pedal the bike between 55 to 65 RPMs. The patient must keep a relatively consistent pace throughout the test. Once the end of the first stage is close, ask the patient to rate their exertion and symptom severity on the RPE and VAS scales. Record their heart rate at the end of each stage. The examiner should also record general observations as the test progresses. Changes to the VAS ratings should be specifically clarified and noted. For example, if the rating moves from 2 to 3, it should be clarified if this reflects the addition of a new symptom and/or increased severity of an existing symptom. 1 point is given for any worsening of a symptom and 1 point for the addition of a new symptom. For example, if the patient reports symptom severity changes from 2 out of 10 to 3 out of 10 and reports a slight increase in headache and the onset of light sensitivity, then this should be considered a 2-point increase to 4 out of 10. Once 1 minute has elapsed, adjust the power output to the wattage for stage 2. The patient must continue pedaling at 55 to 65 RPMs during this transition and through every 1-minute stage. As the test continues, the watts will increase at each stage in proportion to the patient's weight. Continue recording heart rate, VAS, and RPE during each stage and increasing the intensity of exercise until the patient meets the stopping criteria. Once the test is over, reduce the power output to the starting level. To cool down, the patient should pedal at the slowest comfortable RPM. This is often approximately 30 RPMs, but it may vary. Heart rate, RPE, VAS, and any additional comments, if needed, are recorded after the 2-minute cooldown. Following the cooldown, the patient should rest in a chair in a quiet environment until symptom severity returns to the pre-BCBT value or the patient feels comfortable continuing with the remainder of the clinical visit. Provide water and a towel to the patient if needed. The BCBT typically lasts 10 to 15 minutes, including the 2-minute post-assessment rest. Knowing the stopping criteria for the BCBT is important. You should stop the test if there is more than mild symptom exacerbation, which is defined as an increase in concussion symptoms by 3 or more points from the baseline VAS score. The patient reports voluntary exhaustion, which is an RPE of greater than 17 without more than mild concussion symptom exacerbation. The patient can no longer maintain the 55 to 65 RPMs for the BCBT. The examiner notes rapid progression of complaints like pain or pressure in the head, or the examiner notes a safety risk to the patient. The patient has reached 90% or more of their age-predicted heart rate maximum. The patient requests to stop for any reason. The BCBT is voluntary. The examiner should record the reason why the test was terminated on the data collection sheet. Now that the test is complete, we must interpret the results. Concussed patients often experience exercise intolerance after injury. Patients who are unable to reach 85% of their age-predicted heart rate maximum during exercise testing are experiencing exercise intolerance due to concussion. When tested within a week on concussion, most patients cannot exceed 70% of their age-predicted maximum heart rate without more than mild symptom exacerbation. The maximum heart rate achieved on the BCBT during symptom exacerbation is called the heart rate threshold, or HRT. Current research suggests that concussed patients can safely perform aerobic exercise treatment at 80 to 90% of the HRT. If the patient can exercise to voluntary exhaustion without a more than mild increase in concussion symptoms, but is not clear to return to play because of symptoms at rest or physical examination impairments, research suggests that the patient can perform aerobic exercise for concussion rehabilitation without limitation. Participants who have symptoms at rest but who do not experience a more than mild symptom increase during exercise should be evaluated for symptom generators such as dysfunction of the cervical spine, vestibular/ocular motor impairments, anxiety, temporomandibular pain, or migraine headaches. A patient's full clinical presentation should be considered when prescribing aerobic exercise to ensure that your exercise prescription is safe and beneficial. Exercise prescriptions are best when individualized. You now have completed the Buffalo Concussion Bike Test. For more information about this test and for additional resources on other concussion assessments, please visit our website at concussion.ubmd.com.